Welcome to the Karmanos Cancer Center. My name is Dr. Elizabeth Heath. I'm the medical director of the Infusion Center. I, along with your healthcare provider, would like to take this time to welcome you to our cancer center. In this video, you will be provided with important information to make your stay with us as comfortable as possible. We understand that this is a very scary time for you as you have been diagnosed with cancer. Please know that our team of experts are working together to help guide you every step of the way. You are not alone. Your doctor has recommended that you receive chemotherapy as part of your treatment. In this video, you will receive a brief introduction to how chemotherapy works. You will learn how chemotherapy attacks the cancer cells in your body. It's important that you understand the role of chemotherapy in your treatment process. Let's take a look. The human body is made up of millions of cells that vary in shape, size, and function. When cells become old, they self-destruct and die. Cancer develops when this process is disrupted and cells grow out of control. Chemotherapy is a type of treatment that has been used for the last 50 years to treat cancer. It works by infusing chemicals or medicines into the body. It can be used to rid the body of all cancer cells, shrink the size of the cancer, or relieve the symptoms related to the cancer. Because these medicines reach all parts of the body, the treatment can be effective even if the disease has spread. Unfortunately, chemotherapy medicines are not able to tell the difference between cancer cells and healthy cells that also multiply and divide rapidly. This means that healthy cells in areas of the body, like the digestive system, hair follicles, or the bone marrow, which produces blood cells, may also be affected in the process. Chemotherapy can be administered in several different ways. Most commonly, it's through the veins, also known as intravenously or IV. This is the process that we will be discussing in the next video. Please watch Receiving Chemotherapy to learn more.
Hello, my name is Andrea Lehman, and I am with Patient and Community Education here at Karmanos Cancer Center. Today, I'm going to walk you through the process of receiving chemotherapy. Before we get started, you might want to have a pen and paper handy or have someone watch the video with you to help you remember all of the information. You can always pause the video and come back to it at a later time. Let's get started. The main infusion center in Detroit has 20 beds and 14 reclining chairs for your comfort. The Farmington Hills location has 1 bed and 6 chairs. All the centers are fully staffed with nurses who have experience in giving chemotherapy and are a great source of information. They will answer any additional questions you may have about your treatment. And although receiving chemo is generally the same, no matter which Karmanos location it is given, know there may be slight differences at each facility. Our Education and Resource Center, located in the Wirtz lobby at the main campus, has a variety of books and literature available for your use. We also have computers, as well as comfortable chairs with a quiet place to rest. Stop by any time between the hours of 8 a.m. and 5 p.m. The Education and Resource Center is also where we conduct many of our patient education classes, such as chemotherapy, surgery, and catheter care. If you are interested in any of these classes, you can ask our staff at any time, and they can give you the current schedule. By now, you should have received a Karmanos new patient portfolio to help keep you organized. The clinic or infusion nurse will provide you with a chemotherapy module. Insert this module into your patient portfolio under the Plan of Care tab. If you have not yet received one, ask for one at your next appointment. This chemotherapy module will really help you with your care during your treatment. Bring your new patient portfolio with you to all of your Karmanos appointments, including your chemotherapy treatments, and if you are admitted to the hospital for any reason. Chemotherapy is a very complex procedure. The process of receiving chemotherapy is lengthy, as your safety is our top priority. At each appointment, your chemo is mixed and created specifically for you. Plan your day around your chemotherapy infusion. Do not schedule other timed activities on that day so that you do not feel anxious or that you need to be somewhere at a certain time during your treatment. Eat your breakfast and take your usual medications the morning of your chemotherapy, unless your healthcare team tells you differently. Fill in the registration form at the infusion center desk with your name and check the box if you have a port. A port is a device that's placed under the skin and is connected to a catheter. A port allows healthcare professionals to withdraw blood as well as give fluids, chemo, or other blood products. Please keep in mind that not everyone will have a port. Regardless of if you have a port or not, you will need to have your blood levels checked before each and every chemotherapy treatment. Remember, it takes about 45 minutes to an hour to receive your blood test results. So for your first treatment, we may use prior blood work. Ask your doctor if you can have your blood drawn the day before your treatment, and this will decrease your wait time. The phlebotomist or the person that draws your blood works in the lab. They are skilled at drawing blood and will help you during that process. If you have a port, you will be taken back to the infusion center, where a nurse will put a needle in the port and draw your blood. The needle will be left in the port by the nurse if you're going to be receiving chemotherapy that day. On the day you receive your chemotherapy, you may also have an appointment to see your doctor, nurse practitioner, or physician assistant. During this appointment, you'll be checked to see how you're doing and if you're well enough to receive your chemotherapy treatment. If you are given the okay to receive your treatment, check in at the infusion center desk. If you don't have an appointment to see a member of your healthcare team, you will be scheduled for an assessment appointment. During this appointment, the assessment nurse will check to see how you're doing and ask if anything has changed since your last visit. You'll be scheduled for appointments for each of your chemotherapy visits. These appointments will be put on your patient calendar. Keep this calendar handy at all times in your patient portfolio. Once your assessment is done, you will be asked to wait in the waiting area until your chemo treatment is ready. You may leave the waiting area if you would like, but please do not leave the facility. If you are receiving your treatment at our main campus, you will be given a pager because of the volume and size of our infusion center. All chemotherapy is prepared in the pharmacy. The pharmacist will review your chemotherapy orders and make sure everything is correct. When the chemotherapy order has been checked by 2 pharmacists and prepared by the certified technician, it will then be sent to the infusion center. This process is in place for your safety. When your chemo is ready, you will be taken to a patient station with a chair and a privacy curtain or a private room with a bed. 1 to 2 family members or friends can stay with you. We encourage family or friends to accompany you to your appointment, as this will help pass the time. It also provides another set of ears to hear detailed information, ask questions, or help you remember information later. However, for safety reasons, no children are permitted in the infusion center. Dress comfortably and in layers as temperatures may vary. Blankets are available if you need them. Your infusion nurse will talk with you about your chemotherapy and will explain each step along the way. For your safety, you'll be asked to state your name and birth date often. At the same time, your nurse will also double-check your armband. The nurse will give you pre-medications to help prevent any side effects, start your IV, and give you fluids. You will then receive your chemotherapy. At first, you may feel a cool sensation, just like with any other IV fluid you may have had. It's rare to have any immediate side effects, but your nurse will monitor you for any side effects specific to your treatment. It is very important that if you feel different in any way, to please tell someone right away. To make the time pass quicker while receiving your chemo, we encourage you to do activities that you enjoy. Some examples include knitting or sewing, playing cards or games, or reading, watching the TV that's available at your station, or listening to some music. You may also eat or drink in the infusion center. You may even occasionally get a visit from our art, music, or pet therapy volunteers. When you are done with your chemo, your nurse will review and remind you of your upcoming appointments on your patient calendar. A scheduler is available in the infusion center to help you schedule any additional appointments. Once your treatment is finished, your nurse will remove your IV and review discharge instructions about how to care for yourself and who to call for help if you need it. For your safety, we encourage that you have someone drive you home after your chemotherapy treatment is completed. The medications that you receive before your chemotherapy may make you feel drowsy or just unable to focus as well as you usually do. We at Karmanos Cancer Center hope that this video helped you get a better understanding of the process of receiving chemotherapy. Please take some time to watch the next video, Managing Chemotherapy Side Effects. Thank you for listening.
Hello, my name is Idris Wiper, and I'm a nurse and educator at the Karmanos Cancer Center. I would like to spend some time talking to you about dealing with the side effects of chemotherapy. It is important to remember that there are many different types of chemotherapy, and your doctor has chosen a chemotherapy specifically to treat your cancer. Just like no two people are exactly the same, no two people will respond to chemotherapy in the same way. Many patients often wonder why side effects occur. Chemotherapy can produce side effects just like any other type of medicine that we take. This is because chemotherapy affects rapidly growing cells. Unfortunately, both cancer cells and certain normal cells grow rapidly and may be damaged by the chemotherapy. Normal cells that are often affected are hair follicles, cells lining your mouth and throat, esophagus, stomach, and intestines. Also, cells that are made by the bone marrow, such as white blood cells, red blood cells, and platelets, may be affected. Your healthcare team will discuss with you possible side effects related to your treatment. This does not mean you will have all the side effects discussed with you. If you have side effects, tell your healthcare team and they will help you manage them. How severe and how long each side effect lasts is different for each person and chemotherapy. We will now discuss how to manage the common side effects of chemotherapy. There are several common side effects of chemotherapy, and the good news is that they will soon go away once chemotherapy has ended. The common side effects of chemotherapy are fatigue, hair loss, nausea, vomiting, diarrhea or constipation, mouth changes, and a decrease in your blood cell counts. Fatigue from chemotherapy can range from a mild to extreme feeling of being exhausted. Many people describe fatigue as feeling weak, weary, and worn out. Although you may feel tired and experience fatigue due to the long day and anticipation of starting treatment, fatigue can also be due to your chemotherapy medication. Some of the things that you can do to help manage the symptoms of fatigue is plan rest periods throughout the day. It is important to relax, rest when you're tired, but remain as active as you can. Research has proven that light exercise, such as walking, will ease the symptom of fatigue and help you sleep better at night. Try not to overdo it and listen to what your body is telling you. If people ask if they can help you, let them help you. Hair loss is another common side effect after chemotherapy, but does not happen with all types of chemotherapy. It usually occurs about 2 to 3 weeks after you receive your first treatment of chemotherapy. First, your scalp may hurt and become tender. Then you may lose your hair a little at a time or sometimes in clumps. It takes about a week for all your hair to fall out. The good news is that your hair will grow back. This usually takes about 2 to 3 months after your chemotherapy is finished. Remember, hair loss can affect hair on your entire body, just not on your head. This includes your eyelashes, eyebrows, arms, legs, nose. Wear a hat to prevent heat loss and protect your scalp from the sun. Wear glasses to prevent debris from blowing into your eyes on a windy day. Keep tissues handy as you may have a runny nose due to the loss of hair inside your nose. We recommend that you plan for your hair loss needs by getting a hair wig, hat, scarf, turban before you actually lose your hair. Karmanos has a booklet that helps prepare for your hair loss and places listed of where to go to purchase these items. Stop by Supportive Services office on the main campus and pick up your free hat and scarf. You may experience nausea or vomiting as a side effect of chemotherapy. Nausea is when you feel sick to your stomach or have that queasy feeling. Vomiting is when you throw up. You may know someone who has received chemotherapy in the past and has had a lot of nausea. Your doctor will prescribe medication to help prevent nausea. The anti-nausea medication that we give today work much, much better than they did years ago. It is important to take your nausea medication as directed by the physician. Stay away from foods that are greasy, fried, salty, sweet, or spicy for the first few days after treatment. Make sure you have enough to eat and drink throughout the day. To help prevent dehydration, take small sips of fluid frequently throughout the day. It also helps to eat 5 to 6 smaller meals rather than large amounts of food at one time. If you are having difficulty or need assistance with your meal planning, ask to speak with one of our registered dietitians. If your nausea and vomiting is not controlled with your current anti-nausea medicine, contact your doctor for additional instructions. Chemotherapy can cause constipation. Constipation is when the stool is less frequent, hard, and very difficult to pass. Constipation can occur within a few days of receiving your chemotherapy treatment. Constipation may be prevented by drinking at least 6 to 8 8-ounce glasses of fluid each day. Include a glass of warmed prune juice if you are able. Limit the amount of caffeine you drink. Include exercise in your daily routine. A short walk each day will help. Call your doctor if you do not have a bowel movement in 3 days. Your doctor will give you further instructions. Chemotherapy can cause diarrhea because it harms healthy cells that line the small and large bowel. To help manage diarrhea, it is important that you eat small, frequent meals, at least 5 to 6 a day. Decrease the amount of fiber in your diet, decrease greasy food, and drink at least 6 to 8 glasses of water or clear fluids a day. If diarrhea persists and lasts for longer than 24 hours a day, please notify your physician. Chemotherapy can cause mouth changes, such as dry mouth, metallic taste, and this is because it harms the fast-growing cells that line your mouth, your throat, and your lips. This affects your gums, your teeth, your tongue, and the glands that produce saliva. If you are receiving chemotherapy, it is important that you see your dentist at least 2 weeks prior to treatment. If you require dental treatment during chemotherapy, you must talk to your physician prior to your dental visit. Take care of your mouth. Check your mouth and tongue every day. This way you can see or feel problems such as mouth sores, white spots, or infections as soon as they start. Tell your doctor or nurse about these problems immediately. Keep your mouth moist. Brush your teeth with a soft, bristled toothbrush at least 2 times a day. Continue to floss if you already floss. If you do not floss, check with your doctor before starting to floss. This may cause bleeding. To decrease bacteria, rinse your mouth at least 3 times a day with salt or baking soda water for the first 3 days after each treatment. This will help decrease the bacteria in your mouth. To make this solution at home, mix a 1/2 to 1 teaspoon of salt or a 1/2 to 1 teaspoon of baking soda with 1 cup 8-ounce of water. Swish a small amount of the solution in your mouth at a time and then spit it out. Do not use regular mouthwashes that have alcohol in them, as they can irritate your mouth. Remember to keep your skin clean as well. Keeping your skin clean and well moisturized will help avoid infection. Wash your hands frequently and bathe every day unless instructed otherwise. If you are receiving radiation, your doctor will give you special instructions on how to care for your skin. Taking care of your nails is also important during chemotherapy. Do not cut your cuticles or wear false nails, as this increases your risk for infection. You may wear nail polish and keep your cuticles pushed back. If you are getting your nails done professionally, bring your own equipment to avoid infection. Additionally, your treatments may cause an increased sensitivity to the sun. To avoid sunburn or damage to your skin, use an SPF 30 or higher, as well as a hat, sunglasses, and protective clothing when spending time outdoors. Other side effects of chemotherapy may include a decrease in your memory, difficulty focusing, and this is often called chemo brain. Other side effects could include a decrease in your vision or hearing loss. It is important to remember that these symptoms are only temporary and will adjust once chemotherapy has been completed. Because chemotherapy can have a temporary impact on your memory, it's important that you write things down so you don't become overwhelmed when trying to remember instructions, appointments, and your medication. Use your Karmanos portfolio to keep yourself organized and on track. In your portfolio, you have a medication log. It is very important that you keep track of all medications you are taking, including any vitamins or supplements. Bring this list with you to each appointment and let your doctor know if you are dealing with any medication side effects so we can help you. Also, if you smoke or use tobacco, try your best to quit during chemotherapy. Quitting smoking during chemo is especially important because the chemicals in tobacco can interfere with the effectiveness of some drugs. Using tobacco also increases your chance of infection, decreases healing, and weakens your immune system. Continued tobacco use also increases the chance of a cancer coming back. We know quitting tobacco is challenging, but there is support available at Karmanos. Remember, if side effects do occur, tell your healthcare team. They will work with you to monitor and manage your side effects. Don't be afraid to tell us what you are experiencing. Also, follow the tips in the chemotherapy and new booklet that was given to you and placed in the My Care Plan section of your patient portfolio. Call your healthcare team if these tips do not work or if you have any questions. Remember, you are not alone. We are here to help. Get plenty of rest. Take naps before and after activities as needed. Talk with your healthcare team if you are having problems sleeping. Continue your usual activities, work, exercise, and leisure when possible. Strenuous activity is not recommended. Regular light exercise is important, such as walking. Eat a well-balanced diet. Eat as nutritiously as possible. If you need help planning your meals or are losing weight, ask to talk with a dietitian. Drink 6 to 8 8-ounce glasses of fluid a day, water, juice, or other liquids, and limit your caffeine. In addition to knowing when to call us for support, it is important that you know when to call the doctor. If you have signs of infection, such as redness, swelling, rash, a fever of 100.5 or higher, please call the doctor. You also need to let your doctor know if you are having ongoing diarrhea, nausea, vomiting, or constipation, especially as it is important to keep yourself hydrated. Remember, there are often ways in which we can help with these symptoms. Also, let your doctor know if you are having problems urinating, difficulty with swallowing, or substantial weight loss. Some other cases in which you need to contact your doctor include problems sleeping or fatigue. Fatigue includes feeling tired, weak, or just having no energy at all after resting. Let your doctor know if you are experiencing dizziness, difficulty breathing, or abnormal bleeding, including blood in your body excretions. Your doctor will also give you specific instructions on when to call. If you are not sure if you need to call your doctor, please just call so we can help you. We hope that this has given you a better understanding about the side effects related to chemotherapy, and it's eased some of the fears and concerns you may have had about your chemotherapy treatment. You have been given some great practical tips, and our hope is that you'll use these tips and practice them at home. If you want more information, you can call the 1-800-Karmanos number or go online, karmanos.org. Thank you and have a good day.
I'm Kathy Reynolds. I'm a clinical nurse specialist here at Karmanos Cancer Center providing counseling and supportive services. Chemotherapy is a process that can really take a lot of energy and time away from your everyday life. It's so important for us here at Karmanos to know that you feel supported through this entire process. I'm going to spend some time talking with you about how to cope with chemotherapy before, during, and after the process. This is a stressful time as you wait for your treatment to begin. So you might find that you're worrying about the disease spreading and also having to deal with a lot of decision making about what type of treatment you're going to participate in. Your doctor is aware of this process and he understands that it does take time to prepare you to start treatment. Please know that he is aware of the time limit and he would not put you in danger by waiting too long. If he felt that you needed to start treatment sooner, he would speed up the process.
A few things to remember while you are waiting to start chemo. Remember that you have hired us. You have made a decision to seek treatment at this facility, and you will pick your treatment with your doctor. You will make important decisions along the way. Be aware that you are not a victim. The anxiety about whether this treatment will work can be overwhelming. In cancer treatment, we often need to switch treatments and doses of treatment medications. It does not mean that you are losing a battle.
As you begin treatment, there are a number of issues that can affect coping. One of them is your concern about how it's going to affect your everyday life. Treatment is going to affect your everyday life in many ways. One in particular is your energy. Your body will send you messages that tell you that it needs rest, and you need to listen to it. If you don't listen to it, if you try to push your body beyond the activity level that it can tolerate, you're going to be draining yourself of energy that you need to receive the chemo and allow it to work.
As you have heard, chemo does affect your memory. Knowing that this is to be expected, you can avoid being worried about it and plan for coping with it by using note-taking and a little bit of humor to get by. Remember, it will all return over time after your chemo has ended. Your body may go through changes like hair loss, discolorations, etc. due to the chemotherapy medications. They are hard adjustments to make for everyone, men and women. Continue to remind yourself that this all will settle down, hair will return after chemo ends. Lastly, it is important for you to know that some therapies affect your mood, sometimes causing depression or anxiety. Be open with your doctor if you feel these mood changes. We have help for you with medications to manage these mood changes.
In addition to taking care of yourself, you need to understand how chemotherapy might affect your relationships. Your needs come first, but talk to your friends and relatives about what you're going through. It's important to talk to children to be as honest as possible. They often will fear the worst if they don't have the information they need.
If you have a partner or significant other, try to keep things as normal as possible. Allow them to support you. Communicate what you're going through and how they can help. Remember, there are many ways to express intimacy. With physical intimacy, make sure to use a condom as chemotherapy is excreted through bodily fluids. Some chemotherapy can also cause a person to be sterile, so talk with your doctor before starting chemo, as there are ways we can help with this.
It's normal to feel anxious and worried at this time. Your friends may say, "You should be glad it's over." But many patients feel cut loose, out on their own, alone. You're used to the constant monitoring, the medical assessment, the attention to your illness. All of these gave you a sense of safety.
You should know that after treatment, it is best to have longer periods of time between tests and exams. Your treatment continues to work even after we have stopped giving it to you. Of course, you will worry that it might come back. We are hoping you will do less of that worrying as time goes on and you see that you are doing well. If the worrying continues, you might want to use our counseling service to help you work on this problem. Lastly, be kind to yourself. Don't expect yourself to get right back to your former energy and activity level. It will take a number of months after chemo stops to get back to normal.
Everyone deals with cancer in their own way. There's no right or wrong way to cope with cancer. However, some people feel sad or anxious or feel that they're alone on their journey in their cancer treatment. Please let us help. We never want you to feel alone. There are many supportive services available for you here at Karmanos Cancer Center to help you cope with cancer.
At Karmanos, we have full-time oncology social workers, counseling services, and patient educators, all here to support you through this process. We also offer a variety of support groups and complementary therapies, as well as offer appointments with our fatigue and pain clinics. These programs and services are free, and many are open to your loved ones as well. We can provide referrals to a variety of programs and services in the community as well. If you need something, ask. Don't hesitate to call us at 1-800-KARMANOS so we can assist you.
I've given you a lot of tips and information about how to cope with chemotherapy. Remember, this information will help you on your entire cancer journey for both you and your loved ones. I cannot stress how important it is for you to ask us for support when you need it. For more information, call us at 1-800-KARMANOS or visit us online at karmanos.org.